Hello, my name is Doug O'Connor from Massage Carlsbad, and I'm here to talk to you today about forward head posture from a massage therapy perspective. People often ask me what it is I look for when I'm looking at people's posture right before they get on the table. So we'll examine forward head posture in that context and try and answer a couple questions. So first of all, side view. If I have a forward head posture, it's going to look similar to this. And if I have a plumb line coming all the way down, and the plumb line goes through the AC joint right here, my ear is going to be forward of that plumb line, denoting forward head posture. Also, please note, I'll be looking for kyphosis in the mid-thoracics, and also looking at the rounded shoulders to see if there's an internal rotation in the head of the humerus. All these things are just indicators or clues as to what we should do when you're on the table and what we should be trying to accomplish. So what we're really trying to create is a more ideal posture for you. Something like this with the head above the spine. Why is this important? Because for every bit of forward head posture that you have, that creates more tension, more stress for the muscles that are trying to keep your head from rolling forward. Why is this important also? That posture can lead to chronic neck pain, it can lead to headache tension or tension headaches, it can lead to loss of range of motion. So what we want for you is the ability to get into the proper posture and the ability to stay in the proper posture. So the ability to get into the proper posture, to stretch that front part of your body, and the ability to keep that posture by strengthening the back part of your body. We just can't tell ourselves to get into that posture because it might be unnatural for someone who's had the forward head for a while. So we have to train our bodies to lengthen out the front and strengthen the back. From a massage therapist perspective, what we're trying to do is maybe lengthen the pectoralis minor muscle, pectoralis major muscle, subclavius, amongst others. And also the exercises that you would perform, that would be given to you by say a physical therapist, would be exercises that would strengthen the rhomboids, strengthen the mid-traps, and strengthen the external rotators. I want to stress it's very important to approach this from both points of view, from the lengthening of the front and the strengthening in the back to hold the proper posture, because if you just lengthen out the front, you won't have the strength to keep that posture. It'll go right back into a forward head. If you just strengthen the back, you'll ratchet yourself right down such that you feel trapped inside your own body. So it's very important to approach this problem from both perspectives. Both the lengthening, could be stretching, could be massage to lengthen, and the strengthening, just very easy exercises to strengthen. And from both perspectives, from both sides, they're both necessary. So this is an exceedingly simple, simplistic view of what forward head posture is. It doesn't take into account several different things. For instance, that as that neck and that head lever out, the head will swivel back, and with that swivel create even more tension here in the neck. Also, some people have a shoulder that is higher than the other shoulder, maybe due to a small scoliosis in their spine. But if that shoulder is raised, there's a translation laterally of the head and neck, and with that comes tremendous tension and muscle imbalance in the neck that maybe even needs to be taken care of prior to looking at the forward head posture, which is the subject of another video. I do hope I've answered a couple questions. For instance, what we look for as massage therapists when we are looking at your posture, and also what we're trying to accomplish when we get you on the table. So thank you very much for listening. I really appreciate it. Aloha.